Welcome to the Connection Podcast, presented by the Yuma Cares Coalition, where voices from prevention and mental health come together to inform, educate, and strengthen our community. Because connection is prevention.
Welcome to the Connection Podcast. I'm Joanne Pfizer, Executive Director of the Yuma County Anti-Drug Coalition, and I'm excited to have today our guest.
Beto Garcia, Clinical Outreach Manager with Charlie Health.
Today we're going to be just talking and having a good conversation about Charlie Health, and I'm just going to ask you a few questions that you've been part of our coalition for quite a while,
Right.
and we're really excited to have you be part. You're a pillar in our coalition, and I love that you attend, consistently. You're just somebody that we can count on, which is amazing. Yes.
Thank you.
From your perspective, okay, Charlie Health, Beto Garcia's perspective, what has partnership been with the coalition that has meant the most to Charlie Health impacting Yuma County? Can you share with us a little bit about that?
Yeah, no, definitely. And thank you for having me.
Yeah,
it's
you're
a
welcome.
huge pleasure to be here, and such an honor to be a part of the coalition and join you and all the good people of the coalition. I think to answer your question, what it's meant the most has been to be able to build the trust, I think, with all community partners. I think when you join a movement like the coalition that we're a part of, we're all there ultimately to serve the community. And you don't take that lightly, right? So you have to know who you're working with. You have to build that trust and know that the person you're helping is going to be able to count on that other person in the coalition. So to me, I think that's been the biggest thing, is building that trust and connection with everybody.
That's so important. And you can see that like around the table. Every month we have people that come in that are new and they feel the same way. I think that's almost immediate because we are there for that mission. You know, we're all impacting Yuma County, making it a better and safer place for everyone, and just sharing our agencies and the opportunities that we can link together and collaborate together. And I just think it's so important. These podcasts are so important, right?
Oh, of course.
Right? Because we're sharing the history of our coalition, but not only that, we're sharing what Charlie Health has to offer to all of Yuma County.
Right,
Which
that, people are changing, the world's changing, and with that, Yuma's also changed and grown, and yeah, just excited to be able to join and help in any way I can.
And I know that I want to say that you have been part a good year now.
About
a year,
coming up
right?
on a year,
Yeah.
I think, yeah.
Could you give us an example of where the coalition has made a big difference with what you do? Because I know you see a lot of people.
Oh, yeah. I think the biggest thing for me, with Charlie Health being a virtual provider, the biggest thing is when I joined the coalition, I was one of the first representatives of Charlie Health that was able to be a presence here, to bridge that gap between what we see here and what Charlie Health's able to bring. So for me, I think I'll just kind of chime back on what I said earlier, is just building the trust, right? Knowing what every moving part of our community does, whether it be law enforcement, whether it be, behavioral health or healthcare or, the school system, knowing all the moving parts and knowing that together we can do a lot. And I think that's what we're doing at the coalition.
Oh, definitely. And give us a little bit of background on Charlie Health. And you had mentioned how it's virtual and the things that you guys do.
Right. So Charlie Health is an intensive therapy provider. Charlie Health provides IOP services to both children and adults. And I think that has been a huge resource for people here in Yuma. I think, for one, there's a place for everybody at Charlie Health. I think connection is huge for human beings. And, after COVID and just with the way the world has gone, I don't think we have the connection as Americans that we used to with everybody. And through a virtual platform like Charlie Health, being able to bring therapy, but really just bring connection to people, no matter where they're at, whether it be in the darkest corner of their room or whether it be, on the couch with their dog or, outside on the porch, wherever you feel is best fit for you to get help, is where we can meet you at. So.
That's awesome. It's such a personal touch, but yet it's virtual. And I think that that's important for everyone to meet everyone where they're at, like you said, what's comfortable for them, what works for them, and to be able to have this opportunity for all agencies, all sectors of Yuma County, the spectrum is so big, but the people that we have around our table are able to share the resources that you provide. And I have seen you
Exactly.
out and about, I've seen you sharing, your resources at the school district and other places, which is
Yeah.
very important. And that's just really exciting.
When I first came to Charlie Health, I think I really just fell in love with the program and what the mission was, right? And I think that's why I'm so passionate about what I do. And when you see me in the community and at the schools, um, yeah, I'm big on leaving the world better than you found it. And I think through my role here, I'm able to do that in the community. So thank you.
That's awesome. That's really awesome. Looking ahead, like I said, you're coming up on a year being with the coalition, but looking ahead, um, how do you see the coalition continue to support what you do and the impact with Charlie House for Yuma County?
Oh, that's a really good question. That's a really good question. And I think um, the coalition is huge, not only for Charlie Health, but for every agency, every individual that's present there, right? It's going to be huge. And we touched on this earlier in the conversation, just getting all of these providers, all of these folks from the community under the same roof. Me and people from the coalition talk about it all the time. We've never seen all of these people from all of these different corners of the community under one roof. Being able to walk over across the room and say, hey, I'm Beto with Charlie Health. When do you have time to maybe go get coffee or, meet somewhere? I'm at the coalition office, right, to just get to know each other and know how we can together best serve the community. So it's going to be huge. The coalition has been huge, and I can't be more excited for 2026.
That's amazing. I'm glad you touched on that because the growth is endless. We have just, I think, surfaced what we can do in this community, and knowing that you go away with that. That means every other agency is going away with that. They're sharing that with their family and friends and coworkers and, cohorts that they work with. And we know that platforms like this, we can amplify the message, and that's important because there's not everybody knows about Charlie Health yet,
Right.
and I really want you to dive in a little bit more about how you guys are in the state, across the country, how
Sure.
you help people a little bit, share with us a
Gotcha.
little bit more in depth about what Charlie Health brings, not only to our community here, but in the future, you guys see, your mission and how your vision is to expand.
Right. So Charlie Health is across the country, and what we do is we provide IOP, intensive therapy services. I think when it comes to, the growth, and you touched on it earlier when you were speaking, one thing I've seen within the coalition is we don't just show up, talk about things, hand out papers, and leave and just get back together next month. I've seen this firsthand, with the newer program like Charlie Health. I have seen the people that I meet there go back into the community, spread that word, and come back and say, hey, there's these people that actually found a lot of value in what you do. Not only with Charlie Health, but with every program that's in there,
That's
right? I think
amazing.
we have a lot of go-getters. We have champions like yourself in the coalition, and we don't just talk about it, we actually do it, if that makes sense. We don't just talk about things, talk about change, we drive change in the community. And when we leave those meetings, we know that we kind of have like a little badge on us, right? I'm
Yes.
part of the coalition, and with great power comes great responsibility, right? So, yeah,
Well
huge honor.
said. Very, very well said. If there's anything that you would want, let's say, families, educators, community members that are listening to this podcast that get to go back and listen again and share it with family and friends today, what would you want them to understand about you working with Charlie Health, working with the coalition? What would that be? What do you think that we would want them to know?
I think as far as Charlie Health, I mean, I can break that question up piece by piece. As far as Charlie Health, I think one of the biggest things we've learned just as a society is that therapy is different for everybody, right? There's no cookie cutter approach when it comes to therapy because everybody's different, right? Everybody needs a different approach or just a different technique. And through Charlie Health, with the different kind of approaches it can bring, I think that's what people need to understand is that if you've tried different things and it's not working for you, here's another option in therapy that
I
maybe
love
will
that.
work for you, right?
Mm-hmm.
Therapy's still very much new. Our understanding of mental health is still very much new, and I think with that, there's always more out there, and I think Charlie Health is really pioneering in different approaches, and they've seen great success through that. And as far as the coalition, just keep plugging along. I've been very thankful to be there, to see the growth that the coalition has had. I started following a couple of years ago on Facebook,
That's
and I've
awesome.
told you, I've told
Mm-hmm.
everybody that I've met to be here.
That's how you reached out to us.
Was it
I
on Facebook?
remember that. Yes.
Oh my gosh. Well, I would be commenting on your guys' stuff, hearting everything because, years ago I was somebody that was in high school. I was somebody who was surrounded by maybe not the best of things, right? And I know that it took a lot of go-getters, it took champions, it took the right people around me to kind of get me to where I am today.
That's great.
And I see myself so much in a lot of these kids that we work with, even a lot of the adults as well. But I know I wouldn't be here today if it wasn't for all the people that helped me. And I think now it's my turn to give back to the community and help other kids and other people get to where they want to be. So
That's amazing.
Yeah.
I love that. Thank you for being here today. I
Oh,
just
thank
love
you.
that you're our first guest for the new year, and this is just going to be so great. We want to thank everyone for watching today or listening today. You can find us on our Facebook page, our Instagram, our website. You can also listen to us on Spotify, and we just want to thank you, and we wish everyone a happy new year, and thank you for watching the Connection Podcast.
Thank you for joining us. You can find more information and resources on our website at ycadc.org. The Connection Podcast is proudly sponsored by R.L. Jones Insurance.